Hi, I'm Dr. Mitch Shultz, Chief Medical Officer of Alchemy Vision and Medical Director of Shultz Chang Vision in Los Angeles, California. I want to talk to you briefly today about cataracts. A cataract is a clouding of the natural lens of the eye that affects vision. The lens, which is normally clear, is made up of water and protein. As we age, the lens can thicken, and nutrients that maintain the clarity of the natural lens can no longer reach the central nucleus. The lens starts to harden and become cloudy. In addition, some of the protein in the lens can clump together and form cloudy areas. This is what we call a cataract. Cataracts can also be caused by other factors, such as injuries, exposures to UV radiation, or certain medications. Some people with diabetes or a family history of cataracts may also be at higher risk for developing them. Symptoms of cataracts may include blurred or hazy vision, difficulty seeing at night or in low light, sensitivity to glare, double vision in one eye, and the need for bright light when reading or doing close work. Over time, the cataract can worsen and eventually lead to significant vision loss. Diagnosing a cataract. A cataract can be diagnosed through a comprehensive eye exam conducted by a doctor. During the exam, the doctor will check for signs of cataracts by performing various tests, which may include the following. Number 1, visual acuity testing. This is a simple test that involves reading letters on an eye chart to assess how well you can see at different distances. A dilated eye exam. This involves the use of eye drops to widen the pupil, which allows doctors to examine the lens and other structures of the eye. 3. Slit lamp exam. This involves the use of a special microscope that allows the doctor to examine the eye in detail, including the lens. And 4. Tonometry. This is a test that measures the pressure inside the eye and can help detect signs of glaucoma, which sometimes occur along with cataracts. Based on the results of these tests, the doctor can determine if a cataract is present, the size and location of the cataract, and how much it's affecting the vision. In some cases, the doctor may also perform other tests to determine the best course of treatment. Treatment options. The primary treatment for cataracts is surgery. Cataract surgery involves removing the cloudy natural lens of the eye and replacing it with an artificial lens. The surgery is typically performed on an outpatient basis and is a safe and effective procedure. During cataract surgery, the cloudy lens is removed using a technique called phacoemulsification. This is a procedure where we make a small incision in the side of the eye, and a tiny probe is used to then break up the lens with ultrasonic waves. The broken pieces of the lens are then sucked out of the eye, and an artificial lens is then inserted in its place. Cataract surgery is relatively quick. Usually it lasts for 10 to 15 minutes and is usually performed under local anesthesia. Recovery time is also relatively short, and most patients are able to return to their normal acts of life within a few days after cataract surgery. In some cases, a cataract may not need to be removed right away. The doctor may recommend monitoring it and using other treatments to manage symptoms. For example, prescription glasses, anti-glare sunglasses, or magnifying lenses can sometimes improve vision in the early stages of a cataract. Technicians play a critical role in the management of cataract patients by supporting the work of the ophthalmologist in various ways. Here are some of the ways that ophthalmic technicians can help doctors in the management of their cataract patients. Number 1, preoperative testing. Ophthalmic technicians can perform a variety of preoperative tests to help assess the extent and severity of the cataract and to determine the best surgical approach. These tests may include visual acuity testing, refractive testing, corneal topography, and biometry. Number 2, postoperative care. The ophthalmic technicians can also assist in postoperative care by monitoring patients for any complications or adverse reactions, providing patients with education and instruction on postoperative care, and performing follow-up exams to assess healing and visual recovery. Number 3, electronic medical records. Ophthalmic technicians can also assist in maintaining accurate and up-to-date medical records for our cataract patients, including documenting exam findings, treatment plans, and surgical outcomes. Overall, ophthalmic technicians play a crucial role in the support work of ophthalmologists in the management of our cataract patients, and their contributions are essential to ensuring the best possible outcomes for patients.